be performing abdominal packing. I've already checked the physician's order and we have an order for abdominal dressing change, and the dressing change is due now. I perform hand hygiene and gather all my supplies. Now I'm going to enter to our patient's bedroom. I'm going to perform hand hygiene first. As I'm entering, I'm doing my entrance safety check. Make sure the bed is in the lowest position, cobbled within reach, patient is not in distress, no environmental hazards. Hello, my name is Regina. I'm a student nurse from University of Manitoba. I'm here to change your abdominal dressing. But before that, I want to make sure I have the correct patient. Can you please state your first and last name? And I'll be comparing the wristband and the physician's order as well. First and last name, date of birth, any allergies, non-allergies, 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 everything matches. So everything matches. So as I was mentioning, I'm here to change your abdominal dressing, meaning I'm going to be removing the old dressing, assess the site for any sense of healing, and apply a new dressing. Are you okay proceeding with this procedure? The patient says yes, we have obtained our consent, and I've also given you your pain medications 30 minutes before this procedure, and I've also documented in the MAR that I've given the medication. So now what I'm going to do is I'm going to place the bed and the table in my waist level, so they're both now in my waist level. Now I'm going to be performing hand hygiene. All of my supplies are not expired, they are all brand new and they are all intact. I'm aware of my 1-inch border. And I'm going to be placing this garbage bag at the foot of the bed. So now I'm going to be placing our wound ruler here. And I'm going to be peeling back and away from my sterile field. Our 20 gauge Cathlon. I'm going to be peeling back. Another cotton swab stick. Our 30 milliliter syringe. Our kerlex. And our 4x4s. So now I'm going to be opening our brand new normal saline. It's not expired, no discoloration. And I'm making sure there are no splashbacks. No splashbacks, I'm happy with that. Now I'm going to be labeling today's date, time, and initials when this was opened. Now I'm going to be performing hand hygiene and I'm going to be putting on our clean gloves. So I'm going to be pulling the tape gently off of the patient's skin. And we can see that there are two 4x4s. They are soaked with 80% serosanguinous, no foul odor. Discard. And we have one continuous length of kerlex. It's 100% serosanguinous, no foul odor as well. Discard. Now I'm going to be performing hand hygiene. So now I'm not turning my back away from my sterile field. I can still see it. I'm still aware of it. So now I'm going to be performing hand hygiene and I'm going to be putting on our sterile gloves. I'm going to be leaning back. So now I'm sterile to sterile, that's why I'm able to do this. So now what I'm going to do is I'm going to put this here on the side. I'm gonna fix everything first. And I'm going to be activating this, pressing this button to activate the safety sharps mechanism. But for demo purposes, I will not be doing that, and I'll be placing this later in the sharps container. In real life, I'm going to be obtaining 30 milliliter of normal saline, but for demo purposes, I'm going to be obtaining 5 milliliter of normal saline. And we're going to be using a 20 gauge cath one. So now what I'm going to do is I'm going to be cleaning from center to outward, from cleanest to dirtiest, center to outward, from cleanest to dirtiest. And I can see that the drainage is running clear. I'm going to stop this part. Now what I'm going to do is I'm going to be drying. So I'm making sure my forceps is only touching our gauze, it's not touching the periwound skin or the wound bed. And discard. Another one. Okay, and I've dried it from center to outwards as well, from cleanest to dirtiest. So now I'm going to be cleaning our periwound skin. I'm going to be doing it from top to bottom, one swipe per gauze, cleanest to dirtiest. So from top to bottom, tip to tip, one swipe per gauze, discard. Top to bottom, one swipe for gauze, tip to tip, discard. So now I'm going to be drying. From top to bottom, tip to tip, one swipe for gauze, discard. Top to bottom, tip to tip, one swipe per gauze, discard. So now what I'm going to do is I'm going to be measuring. I'll place it here. And I'm going to be measuring. So our length is 14 centimeters in length, 3 centimeters in width, 5 centimeters in depth. And I'm going to be discarding that. I'm going to be taking this, and I'm going to be checking for tunneling and undermining from top to bottom. And I can see that there are no tunneling or undermining. Our periwound skin is not reddened, it's not inflamed, and the wound edges are not curled up. And our wound bed is 100% healthy granulation tissues, no stuffing, no eschar, no signs of necrosis, and there are no foul odors. So I'll be documenting all of those in our IPN and wound care flow sheet. So now what I'm going to do is I'm going to begin packing. So my cotton swab stick is only touching the kerlex, and our kerlex is only touching the 1 inch of the periwound skin that we cleaned. So I'm making sure that all of my wound surfaces are touching our kerlex, and we're not packing, not too tight, not too loose. So our kerlex only touched the 1 inch of the periwound skin that we cleaned. We're still good to go. So our cotton swab stick is only touching the kerlex. I'm going to discard that, and I'm going to be cutting. Okay, so I'm going to discard that, and this is going to go to the sharps container later on. And what I'm going to do is I'm going to be fixing what I packed. So our kerlex only touches the 1 inch of the periwound skin that we cleaned. We're still good to go. And I'm just fixing everything, making sure that I did not pack too tight, not too loose. And all of my wound surfaces are touching the kerlex, which I'm happy about. Okay, so I'm gonna discard that. I'm still sterile, so I'm gonna be grabbing our 4x4s. So now what I'm going to do is I can be unsterile. I'm going to be removing my gloves, performing hand hygiene, and I'm going to be attaching our Me Fix tape with today's date, time, and my initials. Making sure that I'm doing this in an inclusive manner, making sure that I'm covering all of my 4x4s. And I'm going to be overlapping my Me Fix tape. So everything is fully occlusive. I'm happy with that. Now I'm going to be putting the sharps in the sharps container, discarding everything, putting it in the garbage bin, so everything is disposed properly. I'm going to perform hand hygiene. I'm going to put the bed in the lowest position, comfortable within which patient is not in distress, no environmental hazards. I've done my exit safety check, and I'm going to be documenting in my IPN and wound care flow sheet that I packed with kerlex soap with normal sealant, covered by 2 4x4s, and covered with a Me Fix tape. And I'm going to be documenting the measurements and observations that we had and the dressing, the amount of drainage that we removed from the old dressing, and the patient tolerated the procedure well.